facility is Nigeria's first fully equipped private oncology centre, which boasts advanced radiology and radiopharmacy equipment developed and installed by GE Healthcare. Well, I was at the opening of this centre and had this report on how the MRCC seeks to improve the quality of cancer-focused healthcare available in Nigeria. Let's take a watch. For many people around the world, the day they receive a cancer diagnosis would be one of their worst. But the Marcel Ruth Cancer Centre and Specialist Hospital seeks to be a home where someone on their cancer journey would experience their best day. The theory is simple. If Nigerian medical tourists leave the country in search of the best quality medical healthcare abroad, why not bring the latest equipment, 40 experienced specialist healthcare professionals, as well as top-tier physical and emotional care to them right here in Nigeria? But the cutting of the rope, the purpose-built facility in Victoria Island, more than 2 years in the making, was formally opened.
Most people have that impression that unless you have treatment from abroad or from a doctor who's working abroad, then there's no point in getting the care. I believe this is the beginning of that reversal, the reversal of medical tourism, the reversal of mistrust in our medical systems, the reversal in the lack of confidence in our doctors. And by myself being here in the building, hopefully we can also begin to teach, to train, to work together.
I want to make sure that it's not because of the facility or the equipment that they go abroad. Okay, that was very important. So we had the best machine. We have the best linac in the world, okay? Only 5 in Africa, 1 in West Africa. So it's not the equipment you go by. I think you think the environment is pretty nice, okay? It's quiet, it's peaceful, there's the emotional side of cancer is very important. So we're tackling both sides. And so once you realize that, you know what, the radio-oncologists can be in the US, can be in London, because of the telecommunications, they can design the treatment or the chemotherapy, and we have the latest drugs here anyway. Why will you travel? You have the skill here, no.
Financial sense.
Correct. Financial and more importantly, emotional sense.
The World Health Organization argues early diagnosis and treatment could prevent a third of cancer-related deaths. Here in Nigeria, of the 102,000 cancer cases recorded every year, more than 70% of them end in death. Those figures are what the medical professionals at the Marcel Ruth Cancer Centre seek to improve.
Here at Marcel Ruth, we're hoping to do 2 things. One is to make the journey through treatment much easier. As you know, in these parts of the world, when people present to a hospital with any diagnosis, they may have to have their clinic appointment in one place, go and have their labs in another place, go and have their imaging in a different place. That in itself brings even more anxiety, more fear, more worry, and then there's no sort of uniformity of care. What we've done here is bring together all those modalities of screening, diagnosis, and treatment all on the one site. And apart from the clinical side of things, we also look after the psychosocial aspect of things. The other side is for us to ensure that people understand that cancer is not a death sentence. That if you find anything as abnormal, it's so much better to present earlier. Because when you make this diagnosis earlier, the chances of curing the condition is very, very high.
State-of-the-art equipment plays a key role in delivering quality medical cancer treatment. GE Healthcare, a global medical technology firm, has assisted the MRCC with a host of solutions, including ultrasound and radiation systems, as well as this award-winning Senograph Pristina 3D, the first patient-assisted compression device for mammograms.
There's a lot of anxiety and a lot of fear of mammography treatment. There was a lot of reports of some of the older systems that they were uncomfortable and painful, and it was cold and that type of feeling, which actually meant people didn't come and turn up for their mammos. So a lot of thought was put into that, to see how we can kind of reduce the anxiety and the fear. You would apply the system to your breast, and actually the amount of compression is really important to ensure that you get good images. And again, the evidence shows that when you actually self-compress, you actually add more compression because you're in control, you're in charge, and that reduces the anxiety and the fear levels. And you actually get greater compression, and therefore you get greater images.
Though the MRCC is a private facility, it's been welcomed by the Lagos State Governor, who says its presence plays into his plans to revolutionise the healthcare infrastructure in the state.
For us as a government, it's to continue to encourage people like her and ensuring that we can provide complementary infrastructure that would ensure that this facility continues to run and provide, international standards of healthcare for our citizens. This is real conversation around, medical tourism coming back to Nigeria.
As the tour of the facility draws to a close, the message is clear. Cancer needn't be a death sentence, and Nigeria needn't be a cemetery. With the Marcel Ruth Cancer Centre here to save lives. Adefemi Akinsanya, Arise News, Lagos.
Adefemi, great reporting. As always, I loved your closing statement. Cancer does not need to be a death sentence.
Nigeria doesn't have to be a cemetery either.
Absolutely. Yeah. My family and I, we were discussing this. At one point, we were looking for a center for a member of our family, and it was so difficult to find one. I mean, this is such an amazing initiative that even the Lagos State government is helping out with.
Definitely. I think it's definitely been a long time coming, as you've said. There hasn't been, it's the first of its kind in terms of there being a dedicated cancer centre here in Nigeria, here in Lagos. So it's a good thing. There's also a specialist hospital connected to it. So it's more than just oncology. But it's definitely a good thing. It's equipped with a lot of high-tech equipment. You heard Mr. Odunsi talk about them being able to secure the only machine of its kind in West Africa. So for it to be here in Nigeria, it is another good thing for the people here. Also, they can only hope that they would go to some lengths to stopping the outflow of patients, people and funds going out of the country in order for medical tourism. You also heard both Dr. Elemite and her husband, Mr. Odunsi, both say that we don't want people to leave Nigeria because of the lack of equipment. That's why this centre, in conjunction with GE Health, supplying all of the, these technical and technology-based solutions in terms of the equipment there, is so important to offering quality care. This is a private institution, so there's also the issue of accessibility for many people in Nigeria. And I also said that of the more than 100,000 cases, a diagnosis of cancer in Nigeria, more than 70% of them end in death. So we need to have at least 10 more of centres like this to even scratch the surface of the cancer numbers that we have in this country. But Marcel Ruth Cancer Centre is definitely leading the pack, and I'm sure that they are going to do great work. They've already opened for care for patients.
So I wanted to ask, I like that point that you just raised. Did you find out if there's some sort of subsidization for, people that are very, low income or anything like that?
As it stands, I think the cheapest way to gain any type of quality healthcare in Nigeria is through medical insurance. And so here in Nigeria, there are obviously Nigerian insurers, and also I believe the Marcel Ruth Cancer Centre also takes international insurers as well. As it pertains to there being a public relation to the public, I don't know as it stands now what that relationship is, because it is a for-profit organisation, it is a private hospital.
Of course.
But you did see the Lagos State Governor commend them and say that they are also in the process of building more public institutions where they can tackle cancer for many of the people here in Lagos, because as we know, it's a densely populated place, and for a lot of issues, poverty and funds separate people from being able to access quality healthcare. So as it stands now, I think that if you have access to medical insurance, definitely use it and try and see if that can get you access into centres like this.
I did see that it's not just a centre, it's a hospital as well.
It is a hospital.
What was the capacity again?
That I'm not too sure.
Okay, well done. Well done, very well done. Well, and that brings us to the end of the morning show today.